Hello, ladies and gentlemen. My name is Vasilia Christaki, and I'll be discussing the relationship between ADHD and eating disorders in adolescence. Both ADHD and eating disorders are complex and challenging to manage, but they also often co-occur, which complicates the lives of these people, and calls for a better understanding of their connection. I hope to share insights today that will clarify these links and offer ideas on support strategies. To start, let's clarify what ADHD entails. Defined by the DSM-5, ADHD is one of the most prevalent neurobiological disorders diagnosed in childhood. It involves symptoms such as inattention, hyperactivity, and impulsivity. These behaviors affect the child's ability to focus, organize, and even control impulses, impacting not only academic performance, but also personal and social relationships. Moving on, let's examine the role nutrition plays in ADHD. Historically, some thought ADHD was linked to food allergies or sugar intake. In the past, sugar and dietary supplements were often thought to contribute to hyperactivity in children with ADHD. Many parents noticed that after their children consumed sweet or soft drinks, symptoms seemed to worsen, especially in terms of attention deficits. This observation led to the belief that certain foods or ingredients could directly influence ADHD behavior. Another theory suggested that ADHD might stem from a genetic anomaly that creates an increased need for vitamins. The idea was that by supplementing with vitamins, one could address ADHD symptoms. However, this theory lacked strong scientific backing. In fact, studies have shown that excessive vitamin supplementation can sometimes do more harm than good, leading to negative effects rather than improvements in behavior. However, research now shows that while food doesn't cause ADHD, diet does impact symptom severity. Studies show that individuals with ADHD tend to consume more unhealthy food, such as fats, sugars, and processed items, while often neglecting nutrient-dense options like vegetables, whole grains, and fish. Research indicates a link between ADHD and what we call emotional eating. Adolescents with ADHD facing academic or social difficulties may turn to food for comfort. This can lead to irregular eating patterns that not only affect their physical health, but also their mental well-being, making ADHD symptoms harder to manage. Given that diet influences symptoms, various dietary interventions have been explored. For instance, elimination diet aim to avoid foods that may trigger sensitivities, such as gluten or artificial colors. Although some individuals report improvement, the scientific backing for this diet is limited. More promising results have been found with the Mediterranean diet, which emphasizes fruit, vegetables, whole grains, and healthy fats like olive oil. Research has shown that adolescents with ADHD who follow this diet report improved symptoms and better overall health. This diet is thought to support brain function, which may help reduce impulsive eating behaviors. Now, shifting focus to eating disorders. Most eating disorders beginning in adolescence, often around ages 12 or 13, and disproportionately affect girls, although boys are also at risk. Eating disorders are often rooted in a distorted perception of one's own body. Individuals with eating disorders may see themselves in a way that doesn't align with reality, leading to harmful behaviors around food and body image. This distorted self-view often goes hand in hand with an intense preoccupation with body shape or size, coupled with low self-esteem and personal traits, contribute to the development of eating disorders, creating a cycle that can be challenging to break without proper support and intervention. So, how do ADHD and eating disorders connect? Studies show that around 20% of adolescents with ADHD also struggle with eating disorders. The two conditions share underlying factors like impulsivity, emotional deregulation, and self-esteem challenges. ADHD symptoms can actually fuel eating disorders behaviors. For example, ADHD-related impulsivity may lead to binge eating, where control over food intake is lost. Similarly, adolescents with ADHD who struggle with academic or social setbacks may turn to food for comfort, which can lead to cycles of guilt and body dissatisfaction, intensifying both their ADHD and eating disorder symptoms. Let's delve into specific disorders commonly seen in individuals with ADHD. Anorexia nervosa, this eating disorder, is less common in ADHD, but can manifest in adolescents who use extreme dieting to cope with stress or feel a sense of control. According to the DSM-5, a defining feature of anorexia nervosa is a profound disturbance in the way an individual perceives their weight and body shape. This disorder is marked by a severe restriction of energy intake, meaning that the person consumes far fewer calories than their body needs, resulting in significantly low body weight for their age, gender, and physical health. Anorexia nervosa most commonly emerges during adolescence and young adulthood and is more prevalent among females than males. It can have devastating effects on physical and mental health, highlighting the need for a comprehensive care and support. Bulimia nervosa is particularly common among adolescents with ADHD, especially girls. Impulsivity in ADHD can worsen binge purge cycles, where food becomes both a comfort and a source of guilt. In the DSM-5, bulimia is characterized by a lack of control over food consumption, which leads to recurrent episodes of binge eating. After this binge episode, individuals with bulimia often engage in compensatory behaviors to prevent weight gain, such as self-induced vomiting, excessive use of laxative, or intensive exercise. Bulimia nervosa brings with it serious health risks, including gastrointestinal issues, electrolyte imbalances, and even cardiovascular complications. Beyond the physical risks, people with bulimia often struggle with low self-esteem and an intense preoccupation with appearance. Binge eating disorder is frequently observed in adolescents with ADHD. According to the DSM-5, binge eating disorder is marked by recurrent episodes of consuming large amount of food during which individuals experience a loss of control over their eating. Unlike bulimia, however, binge eating episodes in this disorder are not followed by compensatory behaviors like vomiting or excessive exercise. Research has shown that individuals with binge eating disorder tend to have reduced levels of ghrelin, a hormone that helps regulate hunger. This hormonal imbalance may partially explain why individuals with this disorder struggle to control their food intake. Contributing factors can range widely and may include childhood obesity, challenging family relationships, high parental expectations, negative comments about weight, and problematic dietary habits. Adolescents with ADHD often face social and emotional challenges that impact their self-image and mental health. They may experience rejections and bullying from peers, frequent conflicts with parents, and intense feelings of anxiety and depression. These challenges can contribute to negative emotions and a distorted body image, which can in turn lead to unhealthy eating habits, sometimes manifesting as episodes of bulimia. ADHD is fundamentally a self-regulation disorder, affecting not only focus and impulse control, but also eating behaviors. Because of this, adolescents with ADHD are at an increased risk of developing eating disorders. Adolescents with ADHD often struggle with a greater loss of control over their eating compared to those without ADHD, a pattern known as loss of control, lock eating. Another factor affecting eating behaviors in adolescents with ADHD is the use of stimulant medications, which are commonly prescribed to manage symptoms. These medications often suppress appetite, and in some cases, prolonged appetite suppression has led to slowed growth and, in severe situations, hospitalization in eating disorder clinics. This connection between ADHD, medication effects, and disrupted eating patterns underscores the need for careful monitoring and support to help adolescents maintain a healthy relationship with food and balanced nutrition. ADHD has been identified as a risk factor for obesity, largely due to a tendency toward unhealthy eating patterns. Adolescents with ADHD are more likely to consume junk food and sugary drinks, which can exacerbate ADHD symptoms and increase the risk of obesity. Research also shows a notable difference in the rates of ADHD-related eating disorders between genders. Girls with ADHD exhibit higher rates of comorbidity with eating disorders than boys, particularly in relation to bulimia nervosa. Specifically, studies have found that 1% of girls with ADHD are likely to develop bulimic symptoms compared to 0.20% of boys. Boys and girls with ADHD are at risk for developing symptoms of bulimia nervosa and experiencing body image dissatisfaction during mid-adolescence. This period also brings an increased body mass index, BMI, which heightens the risk of disorder eating patterns. Hyperactivity, impulsivity, and inattention are often linked to an excessive preoccupation with food and issues related to feeding control. In particular, studies have shown that impulsivity in girls is a predictive factor for the development of bulimic symptoms. Additionally, deficits in executive function, such as attention difficulties and impulsive behavior, are recognized as common neurocognitive characteristics associated with obesity, eating disorder, and ADHD. Adolescents with anorexia face significant challenges, including a comorbidity rate of 2.3% with ADHD, This connection highlights the complexities of mental health among our youth. Interestingly, 8% of adolescents with ADHD exhibit symptoms resembling anorexia, but do not fully meet the diagnostic criteria. Furthermore, the relationship between ADHD and other eating disorder is concerning. 20% of adolescent patients diagnosed with bulimia nervosa also have ADHD. Adolescents with binge eating disorder face a comorbidity rate of 12.6% with ADHD. This statistic underscores the important link between these two conditions. Moreover, the presence of multiple ADHD characteristics, such as hyperactivity and inattention, may lead to even more significant associations with eating disorders. Now, let's see the neurobiology behind this connection. Neuroimaging studies show shared neurological traits between ADHD and eating disorders, particularly in brain regions involved in impulse control and the reward system, such as the frontal lobe. Imaging studies have revealed structural and functional abnormalities in the frontal regions of the brain in individuals with both ADHD and eating disorders. These studies highlight particular disturbances in brain circuits that involve dopamine, a neurotransmitter crucial for regulating mood and behavior. Moreover, individuals with ADHD and those with binge eating disorder show reduced biting release of dopamine receptors. This dysfunction in dopaminergic circuits is linked to impulsive personality traits and the brain's reward system. A PET imaging study, for instance, found that individuals with binge eating disorders and those who with ADHD exhibit lower dopamine levels in certain brain areas. Dopamine plays a key role in the brain's reward system, influencing behaviors around reward seeking, like food consumption. This dopamine imbalance in both ADHD and eating disorders suggests why those with ADHD might be more prone to impulsive eating or binge behaviors. Recent research using fMRI to investigate binge eating has uncovered reduced activation in the brain's reward system. Additionally, a study involving children demonstrated increased activation of the anterior cingulate cortex during a go-no-go task in adolescents with restrictive type anorexia and bulimia. This suggests that different eating disorders can impact brain function in unique ways. Moreover, executive function, which primarily relies on the prefrontal area of the brain, has been shown to be impaired in both ADHD and eating disorders. There is substantial evidence indicating that individuals with these conditions often struggle with cognitive set shifting, working memory, and inhibitory control. Managing both ADHD and eating disorders presents unique challenges, but there are effective treatment approaches. Pharmacotherapy. Stimulants commonly used to treat ADHD, like methylphenidate, can improve focus and self-regulation, but may reduce appetite. This can be a concern for adolescents with restrictive eating tendencies, so clinicians carefully balance medication to minimize side effects. Psychotherapy, cognitive behavioral therapy especially, is highly effective for treating both ADHD and eating disorders. CBT helps individuals recognize harmful thought patterns and build positive coping strategies to manage stress, without relying on unhealthy eating behaviors. Family therapy and psychoeducation. ADHD and eating disorders affect the individual support network, including family and friends, involving parents and caregivers through therapy and education, fosters a supportive environment and aids long-term recovery. In terms of prevention, a multifaceted approach is essential. Early diagnosis of ADHD and targeting interventions for at-risk adolescents can help prevent the onset of severe eating disorders. Schools and healthcare providers are valuable in identifying adolescents who may be at risk. Programs that involve parents, teachers, and mental health professionals can create a network of support. Psychotherapeutic approaches that address both ADHD symptoms and disorder eating patterns have shown positive outcomes as they help adolescents manage challenges in different environments, from home to school. To effectively address the complex relationship between ADHD and eating disorders, several key strategies must be considered. First, collaboration between parents and caregivers is essential. By working together, they can enhance and improve the overall well-being of adolescents, grappling with these challenges. Second, we must prioritize the creation of target prevention and intervention programs. These initiatives should specifically address the link between ADHD and eating disorders, serving as a protective factor against the risk of developing additional disorders, such as obesity and diabetes in adulthood. Moreover, adopting psychotherapeutic approaches that focus not only on the individual, but also on their environment, including family, school, and neighborhood, has been shown to yield positive long-term outcomes. Raising awareness and educating parents and caregivers, along with the scientific and educational communities, is crucial for ensuring timely diagnosis and intervention. Finally, we need to emphasize individualized interventions that cater to the unique needs of each adolescent. By implementing these strategies, we can significantly improve the lives of those affected by ADHD and eating disorders. In conclusion, the connection between ADHD and eating disorders is complex, but increasingly understood. These insights emphasize the need for a combined approach to treatment and prevention, addressing both mental and physical health needs. Thank you for your attention.